We are starting today with the respiratory system, part 1. We're going to cover the anatomy portion first, and then we'll talk about the physiology information. The respiratory system, we're going to start with the external portion that you see. That's the nose. And the nose provides a lot of benefit for cleaning, humidifying, and warming the air as it comes into the respiratory system. You can see the external nares. They're placed right there. Air enters through those external nares, and there are hairs inside here that help to trap bacteria, sling mucus off onto these nasal turbinates or concha. You can see them labeled there. There's a superior, a middle, and an inferior nasal concha or turbinate. When air travels through these concha or turbinates, it is sped up. They're like turbines of a windmill. And that helps to sling the bacteria, viruses, and pathogens and air against the walls of this moist mucous membrane that you can see inside the nasal cavity. So we also have blood vessels that are close to the surface here, and they help to maintain a moist environment. That's why on a dry day you may have a bloody nose. Okay, so we're talking about main goals of the nose. We're looking at air entering here helps to warm, humidify, and be cleansed. There's also cilia that are in these mucous membranes here of the nasal cavity. They help to trap this trap this bacteria, and it is then funneled back here toward the back of the nasopharynx region. You end up having that mucus drip off this uvula, that is this portion here of the soft palate, and you either let that contaminated mucus slide down where you swallow it into your esophagus, or you may cough it up into your mouth where you either decide to then swallow it or spit it out. Okay, so the nose also provides the sense of smell, and it is formed by a couple of bones here. We've got nasal bone up here at the top that forms part of the structure. We have the maxillary bone, palatine bone back here toward the back. We've got a soft palate, and this hard and soft palate do help to provide a boundary between the nasal and the oral cavities. Speaking of that sense of smell, there are olfactory bulbs embedded in the cribriform plate. They carry the sense of smell back into the olfactory nerves into the brain. Just another look here at the nasal turbinates inside the nasal cavity, and cilia, of course, here help to sweep that contaminated mucus back toward the back of your nasopharynx region. Also around the nose area, we have 4 paranasal sinuses. They are hollow cavities and bones, and they help to lighten the skull. These bones are also easy to remember if you keep in mind FIMS, which stands for the frontal bone, ethmoid bone, maxillary bones, and sphenoid bone. That's where we have those sinuses located. So in addition to being hollow air-filled cavities, these sinuses also produce mucus, and they are a resonance chamber for speech. So if you have a cold and your head is stopped up, you can hear your head echoing due to the blockage in those sinuses. All right, so there you can see a ethmoid sinus here, and one of these, it's actually got some clogging or inflammation in it. Next, we move to the nasopharynx, oropharynx, and laryngopharynx regions. These 3 make up the pharynx or throat region of our nasal cavity or nasal passageways. All right, so we're first looking at nasopharynx right here, and this portion is above the soft palate. Soft palate is right there. And then we have the oropharynx, which is behind the mouth. And then once you get down here to this epiglottis, I'll put an E right there for it, we now have a point at which air is routed into the anterior tube, which is your trachea. Food is routed into your posterior tube, that is your esophagus. Let's talk a little more about your nasopharynx region first. That nasopharynx region is home to a cluster of tonsils called the adenoids or the pharyngeal tonsil. And so this is situated at the very back of your nasopharynx region. If we were to shine a light and look up through the nasal cavity, you would be able to see those adenoids sitting back there at the back of that nasopharynx region. There's also an opening here. It's an entrance to the auditory tube. You'll notice it's right there. That auditory tube is also sometimes called the eustachian tube or the pharyngotympanic tube. That tube is there to equalize pressure between the tympanic membrane of the ear and the throat area. Now, in children, this tube sits more horizontal, and it makes it easier for bacteria to travel up and cause otitis media, or an inner ear infection. middle ear infection rather. In adults, we seem to have a more angled tube, and it makes it more difficult for bacteria and pathogens to travel up into that middle ear, causing infections. All right, so we've got 3 pharynx regions. We've covered nasopharynx. We now have oropharynx to cover. It has a couple of sets of tonsils. The first set are your palatine tonsils. These are at the back of the throat. You can see these when you say ah. And we also have a set of lingual tonsils down here at the base of the tongue. Now, these tonsils, you might recall from our lymphatic system discussion, are helping to filter pathogens that come into the nasal and the oral cavities before the air or food make their way further down into the lower respiratory passageways. Last region of our pharynx regions is our laryngopharynx. This is the point at which air and food are routed into their proper pathways. So here we've got the larynx opening here, and of course this posterior tube, that if we were to continue following down, that would be the esophagus. Okay, so we've got N, O, and L. That is from superior to inferior, the regions of the pharynx. All right, just taking a look here at the adenoids. They are an alternate name for those pharyngeal tonsils at the back of the throat. Next, as we travel further down into the respiratory passageways, is the larynx. It is an organ. If you keep in mind that an organ has 2 or more tissue types, this one in fact does have 2 or more tissue types. We're going to start off with a couple of anterior features here. You've got the hyoid bone sitting superior. You have thyroid cartilage. And then beneath that you have cricoid cartilage. And below that, I'm going to draw a line. From this point down, you've got the trachea. All right, if you look inside, you can see a fold of membranes here. These are the vocal cords or vocal folds. They vibrate to produce speech. Just another view there, one of our lab models. Okay, so the trachea has an opening. It's called the glottis. It is this space here between those vocal cords. On either side, you do have vocal cords or folds that vibrate to produce sound or speech. This is a video that links to Stephen Tyler at Aerosmith having a laryngoscope put down and looked at his vocal cords while he's singing. We'll skip over that, but you can link to that through YouTube. So interesting fact here about these vocal cords, they do not have cilia, and we have no way to naturally remove the mucus that may accumulate on top of them. So if you happen to have mucus land here, the only way to get it out is to cough or to clear your throat to remove that mucus from those vocal cords. In some cases, people's vocal cords may close and not open, and if that is the case, a tracheotomy may be necessary. And that provides an opening beneath or inferior to the larynx. You can also see in this picture the epiglottis. It sits above the glottis, and it serves as a flap to cover the opening to the glottis when we swallow. You may recall this is a piece of elastic cartilage that serves as a flap here. All right, so we're moving down into the trachea. We're looking in the lower respiratory passageways now. The trachea is about a 4-inch long windpipe. It serves to connect the larynx to the lungs by way of these bronchial passageways. The trachea actually is made up of a lining of ciliated mucous membrane. Now, you may recall we just talked about the ciliated mucous membrane in the nasal cavity that pushes contaminated mucus back toward your throat so you can swallow it, cough it out, spit it out, whatever. Now we've got ciliated mucous membrane that pushes the contaminated mucus up towards your mouth. So then again, you can cough it, spit it out, or swallow that contaminated mucus. You may recall from Bio 210, this is ciliated. It is pseudostratified. Ciliated columnar contain an open setup. Okay. And in this view, you can see the C rings of cartilage that create that patent airway. They are horseshoe shaped here. And that is important because the back side or posterior side of your trachea has no cartilage. In fact, there is room for the esophagus to expand into the back side of your trachea when you swallow a large piece of food. And that's critical for us to be able to have those 2 tubes in close proximity where they're located. You also may notice this trachealis muscle back here at the back. It responds to sympathetic and parasympathetic nervous system responses. If you are under sympathetic control, that trachea will enlarge in size, allowing more air to travel down into your lungs. while during parasympathetic control, our trachea will tend to decrease in size because, of course, we don't need as much oxygen. All right, just another view there of trachea and the nearby esophagus. You can see where a tracheotomy tube may be placed, and although that may be an easy prospect to place, there is danger for bleeding because of the carotid arteries placed on either side. So we have now traveled down to the end of the trachea. We are now in this piece here called the carina. This is the last piece of cartilage on the trachea, and it provides a division point where we now travel into the bronchi. You will notice this left primary bronchus heading this way is actually longer and more narrow than the right primary bronchus, which is wider and shorter. Why do you think there is a difference in shape between those two bronchi? All right, so we've got these primary bronchi dividing off into smaller secondary bronchi. They branch again into even smaller tertiary bronchi. Now, these bronchi all have O-rings of cartilage because we're no longer having to accommodate for that trachea or that esophagus sitting behind the trachea. And again, we still have pseudostratified ciliated columnar epithelium lining these tubes. They push contaminated mucus up to the mouth where you can swallow, spit out that contaminated mucus. We know that smoking damages those cilia. Here you can see the trachea, the bronchial passageways in reference to how they infiltrate the interior of the lungs. You'll notice that the left and the right lung actually have a different set of lobes. The right lung has 3 lobes, the left has 2. Again, there's a difference here between those two, and it has to do with the positioning of the heart. You'll notice the apex of each lung sits superiorly. The base sits inferiorly down here on the diaphragm, and each lung is also surrounded by its own pleura. You may recall that pleura are serous membranes, and those serous membranes are double layered. You have an outer parietal pleura and an inner visceral pleura. Between those two, you have a pleural fluid. All right, so just taking that branching one step further, we have come from the trachea to primary bronchi, to secondary bronchi, to tertiary bronchi, to bronchioles. We are not going to distinguish in this class between terminal and respiratory bronchioles. We will then just follow from bronchioles into the alveolar ducts, alveolar sacs, and then the alveoli. So you'll notice as we travel from the trachea to the alveoli, we're working with smaller and smaller branching of the bronchial tree. Once you reach these alveolar ducts, sacs, and alveoli, we're working with such small structures that we no longer can have cilia brush out that contaminated mucus. So that means that in order to remove anything that makes it that far into your system, bacteria, pathogens, and whatnot, we have to have another way to manage getting rid of those contaminations. All right, so just another view of these grape-like alveoli. They are surrounded by a great blood supply. These are pulmonary capillaries. This is where gas exchange occurs. You'll notice that at the alveoli, we end up removing carbon dioxide from the blood, and we dump it into the airway that we then exhale out, while oxygen is going to be loaded into those pulmonary capillaries. They will then travel these pulmonary arterioles right there and head back to the pulmonary venules, but head back to the pulmonary veins and then back to the lungs. Heart. All right. Once again, here's the look at an alveolus. They are thin-walled, simple squamous epithelial tissue and structure. Makes it easy for gas exchange to occur here. And like we say, you notice there is no ciliated epithelium here, so we actually have cells that manage any bacteria that make it this far. They're called type 2 alveolar cells. And we've also got cells creating surfactant, which is an oily secretion that helps to keep these cells from sticking together. So in babies born prematurely, they don't make enough surfactant, and their alveoli may stick together, causing their lungs to collapse. That's called atelectasis. We'll talk about that term a little later. All right, in review, we are traveling down the trachea. We travel into primary bronchi. we travel into secondary bronchi, tertiary bronchi, and then we get into these very small bronchioles. They will then travel into little grape clusters at the ends. Those are called alveoli, and that's where gas exchange takes place. So the next question is, what gases move into the air space to be removed from your lungs? Okay, and which kind of gas moves into the pulmonary capillaries, and that's going to be transported to your heart for distribution to your body. That one, of course, is oxygen. All right. So we've talked about these pleura. They're going to be critical for our conversation in just a few minutes when we talk about how we breathe. We rely on this parietal pleura here being attached to our thoracic cavity wall and our diaphragm. And those two are actually adhered together, parietal pleura to thoracic cavity wall. Visceral pleura, however, is attached to the lung tissue itself. Now, what is found between those two layers? Serous fluid.